continue my discussions on mammography, and I don't want to bore you with studies, but obviously we had some questions on air today that certainly provoke some further thoughts. And what I mean by that is, one of the questions was basically, in essence, I feel the crux of it was, if I'm talking about some of the negatives of mammography, am I scaring women off from testing, from maybe some potential to define that they have cancer? And the one question was, but they're not talking about women that have maybe been treated or whatever for breast cancer, and mammography saved their lives. Well, in essence, the study did evaluate that, because what they were looking at was mortality. Did you live longer once you were diagnosed, or if there were diagnoses of breast cancer from mammography, or did you not? And this large trial over 25 years does not indicate. This is not the first of its type. And I have a few other today. So please understand today, as we talk about this, I do not want to rail against, per se, just mammography. I think that you need to be aware that there are some potential downsides, that there are some negatives. It's not all what it's cracked up to be. And I think the end game of this should be, why is there not more discussion about alternative approaches to evaluating women's breast health? So, but what I'm also going to do today is take a few minutes and go through what I believe are some very key points that are more prevention and more proactivity, as opposed to just looking at an imaging technique such as mammography and either jumping in support or railing against. I don't want that to be the focal point. I believe that we're to have information that helps you, not to hurt you. That is never the intent of any of the discussions, certainly, that I bring forth. I want to go after the proactivity components of this. You could be a guy listening to this now. Is that what you're going to talk about, his breast health? No, I'm going to go into some other things, and it probably after the break, and maybe answer some questions if we have some. You can submit questions at support@askjoedimatteo.com. Or you can submit comments. Maybe you listen to the show and you're unhappy with my projection of this discussion of mammography. You're certainly welcome. It is welcomed, honestly. For or against, I'm okay with that. I will be open to discussing further, certainly, in this broadcast, or even via some of the questions. But first, I wanted to read to you and just start this off out of Proverbs 3. And it says, "My son, do not let wisdom, understanding out of your sight. Preserve sound judgment and discretion. They will be life for you, an ornament to grace your neck." Now, I don't want to twist this scripture to say, so Joe's talking about mammography, therefore he's bringing me wisdom and understanding, therefore... No. Here's what I'm saying. I don't want to twist. I'll be held accountable for what I convey to you today. "My son, do not let wisdom and understanding out of your sight. Preserve sound judgment and discretion." I believe that this is telling us that we should not only seek it, we should thirst for wisdom and understanding and knowledge, His wisdom, His insights, to give us the ability to preserve sound judgment, reason, and thought. In that context, I believe that no matter even what I tell you, or what I project to you, or what I discuss regarding mammography or any other topic, you should take before God and say, "Lord, is that valid? Is that real?" I mean, you should be seeking God, I believe, on your own. Don't let Him out of your sight. Don't let wisdom away from you. Preserve it, protect it, preserve sound judgment and discretion. We should cherish being people, men and women of God, that utilize sound judgment and discretion. They will be life for you, an ornament of grace that are about your neck, and then you will go on your way in safety, and your foot will not stumble, and your foot will not stumble, and you'll go about in safety, and your foot will not stumble. God is telling us through the Word that literally, as we seek Him, as we seek His counsel, as we seek His wisdom, that then as we seek it and as we receive from Him, that helps us to be able to use judgment and discretion. And that could be in a decision about your family, about how you're rearing your children, about a business decision, about a job move, a career move, an educational decision. I believe it encompasses all those areas. Let me go back very quickly, and I don't want to dwell on this for an extended period of time, but I want to talk a little bit about the discussions that I opened up on mammography and some of the issues with breast cancer. And I'm going to just go through and depict for you a snippet of some of the discussions. And this is just some of what I've pulled over this past week on mammography. I mean, right off of PubMed, by the way. This is not some abstract. These are all PubMed descriptions. They're all abstracts and studies. Lancet and Oncology, International Journal of Radiation Biology, 2011. These are all studies that I've pulled that, not, again, to rail against mammography, but to educate you. And also, I would say, to begin to spur, if you do not come forth with concerns that you have to your physicians in the medical community, everything will stay as is. The status quo will remain. Bottom line is, we need better imaging techniques for women for breast health. We need imaging techniques, meaning that go beyond mammography. That might be MRIs. That might be more sophisticated versions, more sensitive versions of ultrasounds. I'm not sure that mammography is what it's cracked up to be, as evidenced by just what I pulled in about an hour this afternoon, or this past week, one afternoon this past week. So a couple of quick issues. Journal of American Family Medicine, 2013, the March-April version. I give you these so that you can actually, you might be able to Google and look up some of these on your own and at least get some of the quick overviews. You might not be able to access the full article, but you can get the takeaway messages. Long-term psychosocial consequences of false positive screenings on mammography. The big thing that's happening is that we have a lot of false positives. A lot of women that go in, have their mammography screening. Oh, I think you have something. We see something. We need to send you now for more sophisticated, more digital type of viewing. Oh, we still see something. We recommend that you see a surgeon and that we do a needle biopsy. What is the impact of that on a woman's psyche? And how much of that is happening? The retort to my comments might be, well, Joe, that's ridiculous, but wouldn't you want women to pursue if there's a potential problem? Yeah, I'm not saying don't pursue. I'm saying that we have tons of false positives. The imaging techniques that are supposedly more sophisticated, more advanced, are backfiring. The end result of that is women are literally carrying for years the distress of that false positive rating. The abstract was to define cancer screenings and have the potential of intended beneficial effects. 6 months after the final diagnosis, women with false positive changes, and they looked at the values, their inner calmness, their anxiety, all of their functional aspects. 3 years after being declared free of cancer with false positive readings, by the way, women still reported greater negative psychosocial consequences compared to women who had always had normal readings, not any false positives. Outcome, conclusion, false positive findings for screening mammography causes long-term psychosocial harm. 3 years after the false positive finding, women still experience psychosocial consequences that range from that you don't see in women, and I'm not going to get into the detail of this, and women that have not had it. You say, well, geez, Joe, but isn't it better that again, I'm not arguing that. I'm saying that there are a lot of unintended consequences long-term for a lot of women. Digital mammography and its implications for pathology, Clinical Journal of Pathology conclusions. Higher incidence of detection with women that have had this full-field digital mammography in this study was due to improved detection of microcalcification. However, this was achieved at a higher cost of recall rate, B3 rate, over treatment That's a key word. Over-treatment, and it might be problematic with women with digital mammography. In other words, oh, wait a minute, this digital mammography, it's supposedly more specific, but are the components that they're picking up, are they actually picking up cancer, or are they picking up microcalcifications that aren't leading to anything and creating more problems? Possible net harms of breast cancer screening. British Medical Journal 2011. 11 women over 50 invited for breast cancer screening. Now, I'm going to get to my focus point here in a few moments. Quality adjusted years of life, combining life years after that are gained after or post screening with losses of quality of life from false positive diagnosis and surgery. This is going on an ongoing basis. Again, this is not my opinion. This is, if you were to do the research, if you had access to some of this, you would find this information. Conclusion: the analysis supports the claim that the introduction of breast cancer screening, you're not going to believe this, might have caused net harm for up to 10 years after the start of screening. In other words, there's much more negative that flows from this than necessarily positive. European Journal Radiology 2010, exposure to low-dose radiation and the risk of breast cancer in women with familial genetic predispositions. Women with a family or genetic aggregation of breast cancer. Here's what this was about. This is saying that for women that are high risks, they're always told you must start mammography sooner, you must have them every year, and you should start at earlier ages. Low dose, here's the conclusion portion right here. Low dose radiation increases breast cancer risk amongst high risk women. Let me read that to you again, in case you missed it. Low dose radiation increases breast cancer risk amongst high risk women. Women that have had family histories, mom, siblings, grandmother, you're high risk. So do we just depend upon screening, or do we depend upon more integrative approaches, which I'm going to go to in a moment? When using low-dose radiation amongst high-risk women, a careful approach is needed. By means of reducing repeated exposure, avoidance of exposure at a younger age, and using non-ionizing radiation techniques. Ionizing radiation, guess what that is? Mammography. So let me read this to you again. European Journal of Radiation, 2010, November 20 edition, if you'd like to look this up. Low-dose radiation increases breast cancer risk amongst high-risk women. This is a population that is already at a significant risk for breast cancer. When using low-dose radiation amongst these high-risk women, a careful approach is needed. By means of reducing repeated exposure, avoidance at exposure at a younger age, using non-ionizing radiation techniques. Hence what I said earlier, is it not important that we begin to explore an open conversation that we need to find other imaging techniques that are not using ionizing radiative types of concepts that are certainly creating some problem. Estimates of overdiagnosis of invasive breast cancer, cancer causes and biology, 2010, overdiagnosis of invasive breast cancer attributable to mammography screening, not my words, appears to be substantial. Our estimates are similar to recent estimates from other screening programs. Overdiagnosis merits greater attention in research and clinical and public health policy making. It's not occurring. It's just not occurring. Folks, I could go on literally for an hour, and I can't. And I don't want to. Overdiagnosis of breast cancer 14 years after mammography screening. The interpretation, the figures, 14 years of mammography screening indicate that all increase in the incidence of breast cancer is due to an overdiagnosis. Over. Not efficient diagnosis. Overdiagnosis. Findings of tumors that in the absence of screening would have never given rise to clinical illness. Overtreatment. Overdiagnosis, radiation in many cases, surgical procedures. It's a problem. It's a problem. So again, what is my goal here today? To scare you, to to not educate you? No, I believe it's to educate you and to help you, certainly, in this endeavor. So what I want to just talk, and I just pulled these quickly, literally, in 10 minutes between the radio show and doing this live stream. And I believe that if you're a woman, your 40s, your 50s, you could have a mom in her 50s or 60s, you could be a grandmother in her 60s and 70s, and you're thinking about your daughter in her 40s, this discussion needs to be had. What discussion? Looking at these other issues and these other techniques, and what I believe are components that can provide more of a proactive approach. So I just made some notes for you. Why would you, if you're a 45-year-old woman, why would you want to get a fasting insulin? What is that, a blood sugar? No. We talked about this in the last few weeks about how it relates to obesity and being overweight. If you have an elevated fasting insulin, this needs to be requested. We can order it through walk-in labs, at PS Labs, PAS Labs here locally in Pittsburgh. If you're out of the area, this can be ordered through walk-in labs in our relationship that we have with them. Fasting insulin that is elevated, that means you're more insulin resistant. If you watched our weight loss videos, live streams, you need to go back and view them. If you have an elevated fasting insulin, your risk of breast cancer goes up dramatically. Well, how do I lower that? Can I take a pill? No, we need to change our diet. We need to eat more of a high fiber diet. We need to be on foodstuffs and nutrients that naturally help to lower our blood sugar, but first lower this, because if your fasting insulin is elevated, you're at a higher risk for breast cancer. So now this is not saying that you never have a screening technique. I think you need to understand the potential downsides of these screening techniques, but at the same time, you need to now understand what is your points of intervention. These are your points of intervention. Okay? Points of intervention. What do you mean, points of intervention? What can you do to reduce your risk, praise God? That's what this is all about. Your points of intervention. If you love sugar and you eat lots of sugar, your breast cancer risk goes up. I don't know how else to frame that to you. You love to eat Ho-Hos. You love to eat Oreos. You can't stay away from ice cream. I am telling you, I'm not speaking negativity to you. Let's get all that aside. Let me talk facts to you. You love sugar and you eat too much sugar, you increase your risk of breast cancer. Forget about the imaging techniques. Let's talk about what you could be doing that is increasing your potential risk. If you're overweight, as a result of number one and number two, if you are overweight significantly, even not significantly, I don't have the statistics. Literally, this kind of grew out of this program, our radio program this morning. But I'm telling you, for every 10 to 15 pounds that you're carrying extra weight, I am increasing my breast cancer incidence. Your percentages are higher. You eat poorly, you're overweight, you eat a lot of sugar, your insulin's rising as a precursor to managing your sugar, you are increasing your risk. Forget about my discussions earlier on the potential downsides of mammography, okay? Just think about this for a few moments. Number four, you have a low fiber diet. Oh, I don't like vegetables, and that Ezekiel bread's too dry. I love my pancakes. I love Italian bread. I love pasta. The only kind of vegetables I eat is corn and potatoes. Low fiber diet. I've got. See, let me just show you a little something here. This stack. I set it over here. Let me get out of your field of view for a minute. Sorry about that. This right here is all about breast cancer incidence and everything you can think of. A woman consumes, just going to read right out of my notes, just pop to a page. More calories you consume, the less you exercise, your hormones, your estrogen levels build up, your metabolites build up, increase incidence of breast cancer. More calories you consume, the more free radicals you create, the more oxidative damage, you increase your risk of breast cancer. These are just my notes back in 2004. The less fresh vegetables, the less fruits, 46% increase incidence of breast cancer. Insulin resistance, just showed you, increased incidence of breast cancer. Birth control pills, increased incidence of breast cancer. You are a premenopausal woman, you haven't undergone menopause yet, your adrenal function is low, your DHEA levels are low, your cortisol levels are high because of stress, working 2 jobs, etc. And we're all stressed. You increase your incidence of breast cancer. Again, forgetting just the imaging, understanding that much of this not is within your power to control, but you can influence these outcomes. I don't know if we have any questions coming through yet or not. Support at askjoedimatteo.com. If you have some questions, you are welcome to send us some questions. If you have a low omega-3 status, you like deep fried foods, you like fried foods, you go out to dinner, you like to have foods that are deep fried as appetizers, you love fried foods at home, you love wings, and you don't take quality omegas, you have an imbalanced omega-3 to omega-6 and 9 ratio, higher incidence of breast cancer. If you've had 25 or more exposures of antibiotics in your past, in your history, it raises an enzyme, and I'm out of space to write, it raises an enzyme in your gut called beta-glucuronidase. This allows for your estrogen metabolites, not your estrogen, the metabolites to be deconjugated, fancy terminology. All that means is it uncouples, it releases the estrogen metabolites, they're recirculated, they're taken back into your circulatory system, increases your incidence of, you say, oh my God, I was on antibiotics for acne. Again, medicine is telling you, do mammography, do mammography, do mammography. The literature is saying, ouch, boy oh boy, there are some problems with mammography. It's maybe not what it's all cracked up to be. I'm telling you, you need to be engaged in a proactive position. Don't dwell on this. Don't let this strike fear into your heart. These are components of your life that you can control. Okay. Couple minutes. Yeah, we're going to go to a break and just your low vitamin D status. If you have a vitamin D level of below 50 nanograms per milliliter, you get a 25 OHD level done, and it's 17, 23, 29. Your doc says you're okay, you're in the range. Wrong. 50 to 60 is where we should be. If you are under 50, your incidence of breast cancer goes up 50%. Insomnia, you don't sleep. You have a chronic sleeping problem. And I'll tie it to melatonin status, I believe, right here. Lowered melatonin status increases your incidence. Women that work night turns, night shifts, nurses for extended periods of time have an increased risk of breast cancer. Medicine is telling you, don't believe all this nonsense. Mammography is the way to prevent breast cancer. I'm telling you, engage in a healthier lifestyle and protect your health. Folks, we're going to go to a break. If you'd like to send some questions, support at askjoedimatteo.com. Maybe you want to make a few comments. They could be negative. I'm okay with that. I have no problem with reading them. Maybe you don't like my position on this. Praise God, that's fine with me. I am doing what I believe is correct, and I'll continue to try to educate you the best way that I can. Support at askjoedimatteo.com. Josiah will basically pull that for us if you'd like, and we'll read it, and I'll engage it right here. Don't forget, if you're watching this right now, you're on the website. Don't forget, we have a lot of things on special for you right now. At this current time, I'm going to date this, but I'm not going to tell you exact. But there's a lot of things that are available for him, probably some other things before the end of the month. We're going to slip away to a break. Thanks for tuning in. When I come back, 10 minutes, 15 minutes, I'm going to wrap this up. I'm going to talk about estrogen dominance, stress. I'm going to talk about alcohol, and then we're going to tie this all together and how you engage in a proactive breast health future. This might not be directly for you. You could be a 55-year-old guy. You could be roughly my age with a daughter that's 30. This is a message that's for her. It's not for you. It could be for her. Stay tuned. We'll be right back. Enjoy the song. Thanks for being back with us. Live stream with Joe DiMatteo. If you don't know my background, pharmacist, board certified in clinical nutrition, a homeopathic degree and a doctoral degree in naturopathy medicine. The whole idea of what I do in these broadcasts, these programs, is to try to help you, to educate you, how to improve your life, your lifestyle, how to engage and take control of what is going on in your life. Also, in many cases, we're challenging traditional thought in the traditional community. And I don't do that to be oppositional. I don't have an axe to grind. If something sits in my gut, I will tell you that it'll come forth. For years, I have a lot of questions about this en masse approach to vaccines to children and in many cases adults. I have a huge problem with, I believe, this en masse process of mass mammography, everybody, years and years. And if you're high risk, you should have them starting at younger and younger ages. My theme is they're being called deeply into question. One of the emailers reviewing the program said, "Well, can I put these into written format?" To be honest with you, I think I'm trying to even give you the research. And if you have to go back and play this back, British Medical Journal, 25-year follow-up study to breast cancer incidence and the mortality of Canadian breast. You can look this up. You can get some of this information, the basics, maybe not the whole study, but you can access much of this basic information or the abstract or the takeaway message right on the internet. I actually went and I've done PubMed researches. At some point in time, if we can increase our staff, maybe we can then put it into a format where then you can go access it from our site. Until then, that's a very costly adventure, and I don't know that that's happening in the real near future. I'm going to summarize my whole thoughts here about what your prevention opportunities are from a breast cancer standpoint. Not that you live in fear of this, but what I would like to say is that you are in a position to be proactive. You could be 20-something, 30-something, 40-something. You need to be very proactive. You could be in your 50s and you still need to be proactive. Do you know that women gaining weight after menopause, that is also linked to increasing risk of breast cancer? You say, Joe, that's all you've been talking about is weight gain and insulin resistance. Why? Well, because it's a factor. It's a huge problem. The last two areas that we're going to discuss here today are a couple areas. I talked about insomnia before we went to the break. Low melatonin status. Melatonin that is low due to high levels of stress, not making enough serotonin, you don't convert it. It's a powerful antioxidant. It's a powerful protectant. Shown in literature that low melatonin status increases your incidence and predilection towards breast cancer. Estrogen dominance. A woman that is maybe carrying extra weight or maybe not, has actually high levels of estrogen and diminished levels of progesterone. So she doesn't have an adequate balance. See, progesterone is actually, your natural progesterone is supposed to dominate this being your estrogen levels, this being your progesterone levels. Many women have this scenario occurring. In those cases, higher incidence of breast cancer. High stress, high cortisol level, dropping DHEA levels. Many women today going back to school, working full-time, keeping a home, huge stress. So again, women that have had years of sleep disorders, low vitamin D status, been on multiple antibiotics, not paying attention to their diet, overweight, consume a lot of sugar, have elevated fasting insulin. What I want to propose to you is that here's where our problem lies, not in saying, well, I need to begin to screen so that we can detect that cancer. I'm saying, let's be active and understand that we spent 4 weeks in doing weight loss scenarios, not to waste our time. You need to take this seriously. I had an email, and I'll read this to you. This guy has an elevated fasting insulin. His level is 17. He makes a comment. Anything under 4, from what I hear, or anything over 4 is not good. Absolutely. Fasting insulin, meaning in a fasting state, your insulin level should be very, very low, not high. Because when it's high, it increases the risk of breast cancer. I'm going to go right down here real quick. Alcohol consumption. I tell you, I kind of want to just finish with these two things. Alcohol, high levels of stress, imbalance estrogen to progesterone ratios, huge factors. Once again, you taking charge of your health. You have a sleep problem, you need to call the office. You need to have a neurotransmitter test done so that we can evaluate and help you with what's imbalanced and why you're having difficulties there. If you have a long history of antibiotic exposures, you need to be on quality probiotics, probiotic essentials every day. Every day. Why? Because beta-glucuronidase that's elevated deconjugates, uncouples your estrogen metabolites, sends them back into circulation, and then is hyperstimulatory to target organs, female genitalia, breast, and so on. Low omega status, low fiber. Low fiber. Fiber is your friend. Whether you're a guy and you're trying to lose weight, whether you're a guy and you're just trying to build some muscle mass, whether you are suffering from hemorrhoids, whether you have diverticulitis, whether you have a high family history of breast cancer, fiber is your friend. Don't just go taking fiber supplements. Let's get it in our diet. Raspberries. I went through, I'll talk to you maybe in one of the subsequent shows. We'll just talk to you about the value of fiber. Food sources of fiber. Why I want you to eat quinoa instead of rice. Why don't you have a big mixed green salad with chickpeas and garbanzo beans? I'm Italian. We love garbanzo beans. So I'm not trying to force my Italian heritage on you. I'm telling you garbanzo beans, chickpeas provide you with great food sources of fiber. Lower insulin resistance, can help you lose weight, give you a feeling of satiety, reduce your incidence of breast cancer. You following me here? There's a lot on the table here. So I think we've covered this pretty well. These are, the points of intervention. How do you intervene? Is it just with a mammography and suffering all the potential issues and the distress? Or is it you taking the bull by the horns and engaging in a protocol that is helpful to you? Let's take a quick peek at, I don't know, Josiah's passcode. Maybe he'll give it to me. I doubt that he will. And therefore, now I can't. Well, either one. All right. Okay. Hi, Joe. I believe God used a mammography to save my life 8 years ago. I have a very small invasive tumor, estrogen positive, progesterone HR2 positive. It would not have been found so early in its development without a mammogram. I would rather have many false positives than miss a positive tumor. However, I too would like to see other options available. Karen, thank you. Thank you for your wonderful, informative show. God bless you. And blessing to others. Thank you. I appreciate. Good comment. That's why I said I want to hear both sides. I have no axe to grind particularly. I do not want to be an antagonist or a protagonist just for the mere fact of being either one. But I do believe if you do not have the information, I believe that's where the problem is. So certainly we can have, and I love that she sent. I want her to be able to express that to us. My dad really gets bad hip pain on the right side at night while trying to fall asleep. He's a diabetic. Takes Lantus, Metformin, Invokana. Could this be from heavy metals? If those are something you could find. I would really wonder if Dad has bad hip pain. I'd be thinking about arthritis in that hip. If he's not been evaluated by an orthopedic or whatever, he should have some x-rays done on that particular hip, at least once to evaluate to see where he is. I don't know that I'd be thinking about metals. I'd be thinking more about some type of joint structure. There could be some things going on in his lower back. Should see a good chiropractor. I think you start pursuing those components before some of these other levels. Mr. D, my doctor said my vitamin D levels should be around 25. Where can I find medical articles to show him otherwise? Great question. Love it. I'm not sure who this came from. What I would say is a great option might be Vitamin D Council. I believe it's vitamindcouncil.org. It is a nonprofit organization. John Cannell runs that organization. He was the founder about 8 to 10 years ago. You might be able to find some good information. John Cannell is a very bright guy. He's a medical doctor out in California. I think you'll find a lot of good information there. Your doctor said it should be around 25. He's wrong. She's wrong. I will tell you that the levels, without question, are showing between 50 and 60 to be ideal. Let me keep going down the line here. Hi, Joe and Dante. Well, Dante wasn't on today. We had him during the weight and exercise scenario. We'll bring him back on at some point in time. Maybe. If he behaves himself. Going forward in the future, we'd like to do more teaching and more live streams regarding, I would like to do some on skin over the next couple of weeks and skin health for these wrinkles and all that stuff and age spots. We're going to talk about that. Hi, Joe and Dante. Can you talk a little bit more about high fasting insulin levels? How to break them? Fiber's your friend. Exercise and activity is without question your friend. A low glycemic load diet. Go back and view our past live streams talking about how to lose weight, how fiber's your friend, how to consume a diet that is more low glycemic load. My fasting insulin 17. That's a huge problem. I heard anything over 4 is bad. My triglyceride levels are over 300 and my HDLs are 28. My blood pressure's okay. LDLs are okay. This guy is typical, traditional, Glenn, metabolic syndrome. Very classic. High triglycerides, low HDLs. I'm about 50 pounds overweight. It's tough to lose it. If I lose it, it comes back quickly. If I blink, I get you because of your insulin resistance. He's 6'1", 238. I do supplements. I take D. I do the Bs. I do the omegas. No statins. You mentioned glucose essentials. Maybe the answer. I don't know that that's just your answer alone. I think it helps you because it helps to sensitize your insulin. Physical activity and exercise coupled with that could be key. Why not get some of the essential meals? We're going to come out with an Essential Meals Plus, which is lower in carbohydrates, higher in protein. That's right around the bend within the next month. I would recommend without question that you begin to replace meals with that, Glenn. What do you say? I want to get these fasting levels, insulin levels. Notice he's focusing on the insulin levels, not on his glucose. Smart man. Glenn, you're a smart man. Hey, great show, Joe DiMatteo Plus on live stream. That's great. I love it. God bless you and your family. Thank you, Glenn, so much. You're on the right track. I guess the key is you can't blink. You know, we can't blink, we can't see. You're 238. I got to have you start replacing meals. I would have you get the Glucose Essentials Plus. I would get CM Core. I just had a bottle sitting here. CM Core. It's a berberine extract. Berberine is now being shown to help to improve insulin sensitization, help with blood sugars, drop your fasting insulins, help with your triglycerides. Huge, huge benefit. CM Core. Glucose Essentials Plus. I'd probably throw in some glucokinase 1 twice a day. The Glucose Essentials Plus I would do at a minimum 2-3 times a day. You're 51 years of age, Glenn. Now's the time to do it. Don't wait any longer. I believe that's good. Thanks so much for your questions and for your emails. Real quick, one last thing I wanted to cover. I covered this during the with IBS during the show, some radio shows this week, and I talked a lot about what's called these glucans and these fructans. If you're suffering from IBS, I did want to cover this today. If you got IBS, you've got to reduce your wheat. You have to reduce your lactose, which is dairy. You should really look at foods like onions and garlic. I think there's a few more I've listed here. Fructose, high fructose corn syrup, sugar, and then sweeteners like xylitol. All these tols, these what are termed polyols. If you have IBS, bloating, and gas and issues, you get rid of the xylitol and the artificial or these sugar alcohols. You reduce the amount of wheat, lactose, onions, garlic. Let me see if I missed anything. I think that really hits it. You can have a huge improvement symptomatically in your IBS symptoms. Well, I think we're about to close here. Thanks so much for being with us today on the live stream. We'll be with you again next week. Topic probably to be announced during the week, more than likely, unless something comes up like this whole breast cancer and mammogram scenario and paradox. I don't call it a paradox. I call it a problem. Medical community calls it a paradox. Mammograms creating problems. They call it a paradox. I say it's a problem. Let's call it what it is. We'll be live with you next Saturday morning, Lord willing, once again. Probably be talking about how to help your skin, what ages and damages our skin. God bless you. Thanks for being with us. Tell some of your friends and your relatives to view the live stream. Don't forget, take advantage of the specials that are available on the site. Thanks for being with us. Have a great weekend.